Okay, we've now got Addie Butler from the Nurses and Midwives Association.
All for coming to save Medicare. Now, the Nurses and Midwives Association is the union that represents all nurses and midwives wherever they work in New South Wales. Our members deal with people at virtually every point of access in the healthcare system. In the lead up to the recent federal election, our union was so concerned about a then future coalition government's plans for healthcare that we made a TV commercial which tried to warn voters that a Tony Abbott-led government would take us down the path of the American healthcare system. This action upset a lot of people. We were accused of scaremongering. We were branded as liars because we dared to say such a thing. But we are barely past the first 100 days of the Abbott federal government, and the proposals to erode our health system have begun. Nurses and midwives believe that governments elected by us for that purpose have a responsibility to look after the health of all citizens. We believe that equitable access to quality health care, regardless of income or postcode, is our right and not a privilege. We are a very wealthy country and we can afford it. We're not suggesting that governments shouldn't seek to manage health costs responsibly, but we are suggesting that proposals to attack Medicare are both irresponsible and wrong. Nurses and midwives do not agree with a tax on Medicare. They do not agree with shifting the burden of increasing healthcare costs onto those who can least afford it. There is no evidence that a co-payment for GPs or emergency departments will control costs effectively, or that it will improve health outcomes. In fact, there is a lot of evidence, as others have said, to suggest that it is most likely to have the opposite effect, that it will lead to worsening of chronic illnesses, more hospital admissions and increased mortality. Now, nurses and midwives understand these consequences probably better than anyone else. Nurses and midwives are the ones who cope with the overcrowded emergency departments, the overflowing wards, the increasingly sick at home in the community, and they are constantly being asked to do more with less because of budget obsession. We must remember that we have one of the best healthcare systems in the world, and we can afford it. And we can continue to afford it, but not by forcing pensioners, the vulnerable and the less fortunate to dig deeper. That is not the Australian way. We can afford to keep our health system as one of the best in the world by using our funds in the best way and by asking those who have the most to give just a little more. We need to make sure that preventative health services such as GPs and primary health care are properly funded and available to all. And we need to look at where we are spending our health and tax dollars. As taxpayers, we fund the health system. We should get to say where the money is spent. Now, as Sally said, the proposed co-payment would apparently save $750 million. This seems like a lot of money. But the federal government currently gives more than $5 billion every year to health funds to subsidise health insurance premiums. And they have just agreed to let insurance companies increase their premiums by another 6%. And that seems simple to me. There's plenty of savings there. Nurses and midwives have another idea that could work to ensure the sustainability of our healthcare system. It's called a financial transactions tax. Now, this is not a tax on ordinary people. This is where those who deal in the speculative economy, now we're talking about the people who are largely responsible for the global financial crisis, would pay a 0.05% tax on transactions which reap them massive individual wealth. The tax would be almost insignificant to their overall wealth, but would result in billions of dollars in tax revenue. We can tell you more about it later. We Australians pride ourselves on fairness and equity, yet we don't contribute fairly. Our governments allow the extremely wealthy to become even wealthier and expect the ordinary person to pick up the tab when the money runs out. So Tony Abbott, the nurses and midwives of New South Wales demand that you hear us when we say we can fund Medicare properly. We can keep our health system as one of the best in the world if we make the right changes. So we are asking Mr. Abbott to have the courage to do it. Do it, and do it now, and stand up for all the people you serve, because New South Wales nurses and midwives say Medicare is not for sale.